Welcome back to AM Northwest. It's commonly used in the operating room. Now, ketamine has been found to treat depression in life-changing ways. Here to tell us more, we welcome from the Portland Ketamine Clinic, Dr. Enrique Abreu, along with his patient, Tamara. Good to have you both with us.
Thanks for having us,
First of all, I've never heard of ketamine before. Describe it to me and how it's used.
Yeah, ketamine is an anesthetic agent that was discovered by Park Davis and was synthesized initially to put people to sleep to have general anesthesia for surgical procedures. And we've been using it safely in the operating room setting, and it's the most used anesthetic in the world for like 40 years now. And nobody really knew that it had these effects until somebody gave it to a bunch of patients that had pain issues, and then they realized in 2004 that the people had a relief of their depression also. And then a gentleman named Dr. Zarate did a study. The landmark article was in 2005, where they gave it to a bunch of patients that just had depression and recognized that 75% of them were better within a day from their depression. And then it only lasted a short time. And so they did more studies and recognized that with a few infusions, we could make that relief last about a month.
How did you find out? I mean, how did you learn more about this? Because this is the first I'm ever hearing of this.
Yeah, absolutely. It was an interesting story. I had been doing sedation for dental offices for many years. And what happened is a patient saw my card and knew about that study. And he called me and said, hey, would you give me ketamine for my depression? And I quickly thought he was drug seeking and that he was just wanting to use this recreationally. And I basically hung up on him. And after doing some more research, recognized that the gentleman did know what he was doing. I called him back and I said, hey, I apologize. We will treat you. I'll find a way to do this safely for you. And he was been one of our success stories.
That's fantastic. Now, Tamara, why did you go to see the doctor?
Well, I went because I knew that something had to change. I've dealt with depression and episodes since I was 13, and
you were about to lose your job, right?
Well, I was having problems getting to work and getting out of bed and just not being very functional, and I knew that I had to do something different than the traditional medication that I'd been prescribed. I had to find something else, and
how is it administered then? How did you help Tamara?
So ketamine is given intravenously in a series of infusions. It's given 6 times over a period of 2 weeks. So it's Monday, Wednesday, Friday, and then Monday, Wednesday, Friday again. And then that lasts for about a month. And then you come back once in every 4 to 6 weeks to have a single booster infusion. And that will get you through another month of being depression-free.
How have you been feeling then since you've been doing this?
Great. It really changed my life. I had gotten to the point where I wasn't enjoying anything anymore, and now every day there's not a struggle anymore. Just to get up and get on with my life, and I look forward to things, and I have fun, and
so are you saying
it's great.
You're happier now?
I mean, yeah, absolutely. I mean, and now I'm me again.
Right.
Yeah.
You don't have trouble getting out of bed?
Right. I don't have trouble getting out of bed. I have interest in things. I look forward to things.
Now, is this covered by insurance or no?
No, it's currently not covered by insurance. We don't think it will be because it's an off-label use of ketamine. Since ketamine was originally approved just for anesthesia care, drug companies and the FDA don't recognize it for depression, and so it is an out-of-pocket expense. And we do work with psychiatrists also. It's not just me administering it, and that's because I'm an anesthesiologist. However, in order to be seen at our clinic, you do have to have a therapist or psychiatrist that has diagnosed you with a kind of depression, PTSD, bipolar 1 or 2, and then we take that and then we say, okay, this is the right screening tool, and we will treat patients that we find are having the right diagnosis that we know will be helped by ketamine.
Wow, it's an incredible story. I want to tell folks if they'd like to find out more about the Portland Ketamine Clinic, you can call 503-207-4992. We'll put that information on our website at KATU.com. Thank you very much. And Tamara, I'm glad you're doing well. That's awesome.
Thank you very much.
Thanks for having us.